Hello and welcome to this video on the playlist of dermatological cases. Today I want to talk to you about some immunobullous disorders. I'm Dr. Navetri, a board-certified dermatologist. The images here are extracted from some books, articles, videos, and examination. Let's jump into cases. Question 1. All these histopathologies may be related to this figure except what you see here is a severe stomatitis expanding into lip, vermilion of lip. So that this figure is more indicative of paraneoplastic pemphigus. As you know, paraneoplastic pemphigus in histopathology is an overlap between pemphigus vulgaris, lichen planus, and erythema multiforme. What you see here in histopathology, the figure 2 and figure 5, both of them are intraepidermal bulla formation that could be compatible with the diagnosis of pemphigus vulgaris and therefore paraneoplastic pemphigus. And here you see intercellular space configuration that is also could be found in the background of pemphigus vulgaris and also paraneoplastic pemphigus. But in figure 4, there is subepidermal bulla formation that is not related to pemphigus group. It is a prototype of bullous pemphigoid. So the correct answer for this question is 4. You see here another case of paraneoplastic pemphigus, severe stomatitis, here intraepidermal bulla formation, and here intercellular configuration. Severe stomatitis involving the vermilion, overlap between pemphigus vulgaris, lichen planus, and erythema multiforme, and on DIF, intercellular and aligned basement membrane zone linearly. Which one is the best substrate for IIF study? Rat bladder. Here are some paraneoplastic pemphigus cases. Severe stomatitis. Here stomatitis involving the lip. Some cutaneous lesions. Here is eye involvement, lip involvement, intercellular, supraepidermal, intraepidermal is intercellular configuration, and linear basement membrane zone configuration. Don't mistake this figure with the cicatricial pemphigoid. By looking at the eye involvement, as you see here in the histopathology, that the bulla formation is intraepidermal with intercellular configuration. Here another case. What's the diagnosis? You see here lip involvement. And here are some form of stomatitis. So you will consider the diagnosis of paraneoplastic pemphigus at first, but when you look at this figure in histopathology, there is subepidermal bulla formation that is not compatible with the diagnosis of paraneoplastic pemphigus. Actually, the diagnosis case is cicatricial pemphigoid. You know that cicatricial pemphigoid is a kind of immunobullous disorder that typically involves the mucous membranes such as oral cavity and eye. And the bulla formation in this type of immunobullous disorder is typically subepidermal. All forms of cicatricial pemphigoid are characterized by bulla formation subepidermally with the predominance of roof of the bulla, except the anti-epilecrin or anti-laminin free 2 that the floor is dominantly involved. Here you see some bulla formation. In histopathology, there is intraepidermal, actually suprabasilar involvement, and here is intercellular involvement. So the diagnosis of this case is pemphigus vulgaris. What you see here as intercellular involvement is a view that looks like the chicken wire. As you see here, chicken wire. And you see here the view of tombstoning, that is actually vertically oriented basilar keratinocytes attached to basement membrane zone. Another finding that could be found here is the formation of acantholytic cells, acantholytic keratinocytes in this space. This one is also another example of pemphigus vulgaris. Intraepidermally, actually suprabasilar, and here intercellular configuration, as what's said as chicken wire in this figure. You see here chicken wire as intercellular configuration. What you see here? There is bulla formation intraepidermal, intercellular configuration as chicken wire, and here are vegetative lesions. So you can consider the diagnosis compatible with these figures as pemphigus vulgaris in vegetative shape, actually pemphigus vegetans. And here also you see another case of vesicle and bulla formation as intraepidermal bulla formation. Here the DIF is positive for IgA. You see here intercellular configuration. All forms of pemphigus group on fluorescent study are intercellular configuration. The diagnosis for this one is IgA pemphigus. As you see, the test maker mentioned here, the lesions are pruritic lesions. IgA pemphigus presents clinically with vesicles and pustules in circinate and annular pattern. And the drug of choice for this condition is dapsone. You see here another case. The lesion here as erosive lesion. Here intraepidermal bulla formation. Intraepidermal bulla formation not at the level of suprabasilar layer that is compatible with the diagnosis of pemphigus vulgaris, but another type of pemphigus group disorders. And here also is intercellular configuration not at the level of suprabasilar layer. The diagnosis of this case is compatible with the pemphigus foliaceus. This lesion is located in the seborrheic distribution. In comparison with pemphigus vulgaris, pemphigus foliaceus is characterized by bulla formation at the level of granulosome layer. Both of them are characterized by intercellular configuration on immunofluorescent study. Here is also another case, a bullous disease. What you see here is a subepidermal bullous disorder with the predominance of roof of the bulla that is compatible with the diagnosis of bullous pemphigoid. Now, as a recap, I should say that the pemphigus group, all of them, pemphigus vulgaris, pemphigus vegetans, pemphigus foliaceus, and paraneoplastic pemphigus, all of them present with bulla formation in intraepidermal space. Now, we have another case that is involved with some patch on the nose and prefollicular and prevascular infiltration. These findings are indicative of a kind of lupus erythematosus. Here we have subepidermal bulla formation. Here subepidermal bulla formation. In one, the roof is predominant, but in three, the floor is predominant. Here is subepidermal bulla formation with granular deposition, and here is intercellular configuration. So the lupus erythematosus is compatible with subepidermal bullous formation with the predominant of the floor of the bulla. So the correct answer here is 3. This is compatible with the diagnosis of bullous pemphigoid. This is compatible with the diagnosis of dermatitis herpetiformis, and here this is compatible with the diagnosis of pemphigus vulgaris. And you see here another case indicative of lupus erythematosus. As in history, we have fever and arthralgia. Here is subepidermal bullous formation in a linear configuration and predominance of the floor. You see here some cases of lupus erythematosus. Here is compatible with DLE, subepidermal, predominance of floor. Here, dense bulla, dermal infiltration, subepidermal bulla with the dominance of floor. Dense bulla, subepidermal bulla, dominance of floor. These are indicative of lupus erythematosus that is compatible with 1. Here you see another case. Some vesicular and papular eruption on the buttock, granular deposition. So it is compatible with the diagnosis of dermatitis herpetiformis. And you see here another case of dermatitis herpetiformis, vesicle and papules on knee and elbow, and here subepidermal granular deposition. So the GI involvement in the background of dermatitis herpetiformis is compatible with the formation or threat of the formation of lymphoma as MALT. The drug of choice for this condition is dapsone, But dapsone has no effect on immunofluorescence. You see here another case of dermatitis herpetiformis. You see here another case, bulla formation. The bulla are intact. Here a subepidermal bulla formation with the predominance of roof, that is indicative of bullous pemphigoid. Here is another case of bullous pemphigoid. There are some erosive lesions. This bulla is intact, subepidermal bulla, and subepidermal bulla with predominant of floor, predominant of roof. Here is a pregnant woman. As you see here, there is subepidermal bulla, and here a subepidermal bulla in a linear configuration that is compatible with the diagnosis of herpes gestationis. Herpes gestationis is similar to bullous pemphigoid in histopathology. Linear subepidermal. In this case, instead of mentioning to pregnancy, the test maker mentioned to hidatiform mole. Herpes gestationis. Herpes gestationis. And here, which figure is not referred to the other? Lip involvement, eye involvement. These figures are indicative of cicatricial pemphigoid. As said before, all forms of cicatricial pemphigoid are characterized by subepidermal bulla with the predominance of roof except the antiepilechrine subtype that is characterized by the predominance of the floor. So the correct answer is 4, that present a intercellular configuration. This one is related to these figures. Which one is in favor of epidermolysis bullosa acquisita? Epidermolysis bullosa acquisita is characterized by subepidermal bulla that is predominant at the floor. 3 types of immunobullous disorders are characterized by subepidermal bulla with the predominance of floor. 1 is lupus erythematosus, 2 is epidermolysis bullosa acquisita, and 3 is the antiepilechrine subtype of cicatricial pemphigoid. So the correct answer is 1. Which one is related to dermatitis herpetiformis? This subepidermal granular deposition. And here is another case with some lesions on the dorsal aspect of the hand, subepidermal bulla with the predominance of the floor of the bulla. That is, that this history and images are indicative of epidermolysis bullosa acquisita. Here is another case that presents with an erosive patch lesion on the scalp, and on histopathology there is subepidermal bulla formation with the predominance of roof of the bulla. These findings are indicative of cicatricial pemphigoid, actually Bernstein-Perry subtype. If the test maker only give you this image, another differential diagnosis for this image is pustular dermatosis of scalp, erosive pustular dermatosis of scalp. But when the histopathology as what we see here is presented, the diagnosis of cicatricial pemphigoid is more probable, with the predominance of the roof of the bulla. As said before, in cicatricial pemphigoid, the anti-epilegrine subtype is presented with the floor of the bulla. And here, dense bulla, subepidermal bulla, with the predominance of the roof. These figures are indicative of bullous pemphigoid and also the lapped subtype, linear IgA. I hope you enjoyed this video. In the next video, I'll continue other cases.